Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hey y'all, it's Friday and welcome to Healthcare 911. Today we have a special guest, Dr. Tammuella Singleton, Chief of Hematology at the Louisiana Center for Clinical Medicine. Hey Dr. Singleton, how are you?
Hi, I'm so excited to be here.
I know, welcome. I was telling you earlier, you'll be the most beautiful doctor that we ever interview on Healthcare 911.
That's so sweet. Very sweet.
Well, you know, one of the questions, the audience, we post a snippet on Facebook, just a little blurb to let somebody know, let everybody know who our guest is going to be the next week. People want to know, what is a hematologist?
Oh, great. Yeah. So a hematologist is typically, a hematologist has training initially in either medicine or pediatrics, sometimes both. So we start out as sort of, regular doctor training. And then we decide to become specialists and do a fellowship to study all components of blood. So that means your red blood cells that determine if you have anemia or not. That means your white blood cells that control infection, can sometimes go crazy with leukemias. That also means platelets that help your blood to clot. And then all of the other proteins and components that are in your blood that help with coagulation when you need to form a clot. And so for people who have issues with clotting, where they clot too much and form thrombotic events in the chest or lungs, or people who don't have enough clotting proteins for whatever reason, and there are various bleeding disorders that do, like hemophilia, for example, von Willebrand's disease. So we treat everything blood. And what's unique about me is my baseline training is in pediatrics, but I treat both adults and children for very rare bleeding and clotting events. So that's what a hematologist does. And I have a fancy microscope to look at your blood under the microscope.
Oh, that might scare me. Don't take a sample when I come to see you.
I always want blood.
Well, what can a patient, how would a person know they need to visit a hematologist?
It's interesting. When I talk to groups about this, I always, see some people in the audience, their eyes get a little big when I describe anemia, for example, which is a very common condition. Typically at some point you've been told that you're anemic and you're like, yeah, I've been told that before. A lot of people have baseline fatigue that they just push through and learn to accept.
Yes.
Sometimes if you have a craving, we call it a pica. I have patients who tell me they buy bags of ice from Sonic. This is how I learned this, because they told me. So a craving for starch, ice, sometimes dirt. Everybody doesn't like to admit that, paper, but having extreme fatigue or just chronic or long-term fatigue, headaches would be a common one, sort of dizziness, exercise intolerance. So a lot of things that people experience and you just blow it off and try to push through it would ultimately be related to anemia. So that's one of the most common things, but anything from fatigue related to an anemia to bruising, bleeding, clotting, all of those things, you want to see a hematologist.
Well, if somebody was interested in making an appointment, for example, at your office, if they're there in New Orleans, would they have to have their primary care physician call in a referral, or could they call and make an appointment themselves?
Oh, you can absolutely call and make an appointment yourself. Many times we will assist patients if you want to be seen and you need to get a referral from your primary care provider. We will participate in that process to try to facilitate that, to make that happen. So we never want anyone to wait and go, oh, I'm waiting to get a call back, from my primary care provider. We'll push that process along. Some people may have health insurance that doesn't require you to have an authorization or referral from your primary care provider. But by all means, I think it's important. And I think most hematologists sort of have that spirit where we really want to make sure that patients receive the help that they need.
Yes.
So we're very happy typically to assist in that process.
Well, since we've been in the pandemic, May, I think I told you, May is Mental Health Awareness Month. Do you think that there are patients out there who have deferred getting physician assessment because they didn't want to come into the office during the pandemic?
Yeah. Well, first of all, let's back up a little bit because there were patients, sometimes I'm included in that process. You get busy
Yeah.
and you don't see your doctor the way that you're supposed to, right? Days turn into weeks, weeks turn into months, and next thing you know, you're behind and you haven't seen them. The pandemic really only exacerbated that or made that worse. So that appointment that I should have had, 6 months before the sudden
Right.
pandemic that started on March 11th or 13th, whatever day it was, all of a sudden now you're 18 months in the hole, or 2 years in the hole. The very cool thing about most providers now, and this is a positive thing I think that came from the pandemic, most of us are conducting visits virtually or via telemedicine.
Mm-hmm.
So if you can't get in, you're still having difficulty, you can ask for a telemedicine visit that will bridge you over with the agreement that you'll go in to follow up at some point in the next 6 months.
Well, do you have to do blood draws on patients the first time you see them, Dr. Singleton? I would think you do.
Ideally, in some instances, I want to get a little more information
Right.
from a historical standpoint. Ask about family history, ask about what has been going on with you. And even with a telemedicine visit, we can still make arrangements for you to go in after that visit to have labs drawn. And with telemedicine, we can also make arrangements for you to have labs done before you come in. Now, when you come into my office, I have my own laboratory here in the office.
Right.
With our phlebotomist and a nurse. And so we can draw and facilitate that here. Many times that's much easier because I have all of these super rare, strange send out labs that I typically need to kind of escort in and make sure that they're sent to the appropriate place.
Right. Well, what do you think about May being Mental Health Awareness Month? Don't you think this is probably one of the most important Mays we've had in a long time with the pandemic?
Oh, without a doubt. And I'll just be very transparent and say, when I was in medical school, you develop an interest in different things. And you may come to medical school saying, I want to be a surgeon or I want to be, a radiologist, and, find yourself going in a totally different direction. I always think those things are kind of God-driven personally. But I said I wanted to be a hematologist relatively early on. I had this amazing experience, but psychiatry was so far away from anything that I had an interest in. But what I discovered is that you absolutely cannot separate body systems. You can't
Really?
you can't treat half of a patient.
Right.
And so as much as we may want to, meaning non-doctors as individuals, as much as we or you may want to say, oh no, I'm not going to think about what's going on, with me, from an anxiety or depression standpoint, I want to concentrate on my heart disease. You can't separate those two. And so when I'm treating a patient for a heme or hematology related illness, if there's any component of post-traumatic stress, very high anxiety, depression, any of those things that have been left untreated or unaddressed, I can guarantee you that it is going to put us in a very poor position in terms of addressing, treating, or curing whatever it is I'm concentrating on from a hematologist standpoint.
Well, is that
So
how do you address it? How do you address that? And with as a hematologist, just with any other medical condition, the anxiety and depression that patient has, how do you address that with the patient,
Oh,
Dr.
wow.
Singleton?
So one of the ways I try not to be a bull in a china shop, kind of at
Yeah.
first, like as soon as I meet you, sometimes I can't help myself. I really try. But I often explain that we're developing a relationship. And this is a place where we can speak freely, confidentially, and there's no judgment. And there are no political opinions in here. This is all just me and you focusing on your health. And I typically explain that the central nervous system, including the part of the central nervous system where your brain is, that has receptors and hormones that's directly tied to everything else, that I can't dismiss that. And so as we go along this journey and we're trying to figure out how to keep you healthy, give you a better state of health, I will have to sometimes address and talk to you about what's going on from a psychiatric standpoint. And I need us to have an understanding that that's not something that's taboo, and that's real medicine and that's real science. And we will have to address that. And if that's ultimately going to be something that's a true struggle for you, I might not be the right doctor for you, because I can't ignore that. Like, we can't separate that.
Have you ever had a patient sit down in the exam room and start talking to you about anxiety and depression and whatever illness they're there to see you for, and they ask you, "Am I crazy?" Has anybody ever asked you that question?
Almost every day. And it sort of breaks my heart a little bit, because I don't care who you are from a cultural standpoint. It's taboo in every culture. We all have some common ways in terms of how we think about it or describe it when we talk about depression or anxiety. But ultimately, the common word in English is, we would just all say crazy. And, one of the things that we talk about, I'll say, and actually this was like a public service announcement or a commercial, and I wish I could find it. It was the best one I've ever seen. And it showed different scenarios very quickly and sequentially, where there was someone who, had a horrible accident, fell off the bike, broke their leg. And they said, you can handle this the way we approach mental health. Listen, just concentrate. Just think your way out of it. It's not really painful. You can push through. Meanwhile, the person's bleeding, the bone is exposed. Like, it's just so ridiculous. And then they'll show another scenario. So the whole take-home point is, when you have anxiety or depression, that is a real medical condition. And I'll share with you some of the things I say to my family members, because I'll tell my patients this too. I go, well, you can see your doctor privately and have beautiful conclusions and tools that you can use, medications that may work for you, and swallow your pill in the privacy of your own kitchen. See your therapist privately, feel good after that session, walk away with tools so that you can have healthier relationships. Or you can choose to do nothing about all of those things and then share your illness with the whole world. Now, everybody knows that you have severe anxiety. Now, everybody knows that you have horrible depression. And the only person who thinks it's a secret, or who it's really a secret to, is you. It's not a secret to anyone around you. You're a walking ball of anxiety. You drive everyone around you nuts. You have no idea why your relationships are a mess. No one can stand to be around you for 5 minutes. You're depressed. And so you look through those colored glasses and everything is dismal and no one likes you and no one wants to be around you. And what a horrible existence. And the longer you're in that state, I usually explain that there are real hormonal changes that happen. Not to mention, to go off into this topic, as you get older and have hormonal changes, or as you have surgery and have hormonal changes, well, all hormones are linked via a feedback system. So as you have changes in testosterone and estrogen, or with stress, increases in cortisol, well, guess what else is influenced? The hormones that tell your brain to do certain things, to think logically or not think logically, to really be on or to not. And sometimes you're so on, because there's an imbalance from a hormonal standpoint, and you can't think your way through that. So I do say those things when I'm talking to patients, but I say those things when I'm talking to friends and family members too.
I love that, Dr. Singleton. I would never have even thought about hormones changing like post-operatively. Never would have even thought about it.
Oh, yes. And in addition to that, I would often joke in fellowship and training, when you're training to become a doctor, it is the most stressful thing ever. I mean, it's almost inhumane how much stress a person is under during that time, and the lack of sleep. And I would go, you know what? My cortisol levels must be like 2,000. I would like walk around saying that, like my cortisol levels. And what I was saying was my body's natural steroids that give me, strength and stamina and, that drive to kind of keep pushing, that I would call on those so often that they would never go back down to being at a normal level. And so, do you know that contributes to weight around your waistline?
And people lose sleep if people are not able to sleep at night, right?
Sleep. And you have even more. So if you have insomnia, it's like a big cycle. Your cortisol levels are elevated. You're on. You can't sleep. Or if you can't sleep and you're on, sort of later, that puts a lot of weight around your waistline.
Oh, everybody. Okay. Y'all remember that. Need to get your cortisol levels checked.
And those cortisol levels are high. But when your cortisol levels are high, your hormonal chain, if you think about it like a chain, there are feedback mechanisms and arrows that connect each hormone in a chain. So that if one is high, you'll have a compensation by pushing another one down. If one is low, you'll have another compensation by pushing another one up. And so things can really be thrown off with consistent high stress. So when you hear people talk about sort of PTSD, some of those things, post-traumatic stress, that can be tied into that. When we say clinical depression or anxiety, it's because those hormone levels have been on for so long, they can't be turned off. And now another hormone has been burned out and can't, be replaced, or the uptake is too fast. It's no longer present. So there are real physiological explanations in terms of when you feel anxiety or depression. And I said nothing about the genetic predisposition sometimes to some of that.
Wow. Well, how big a difference is there with the stress and anxiety you see in children versus your adult patients?
Oh, wow. So the only difference, to be honest with you, is the way that it manifests. So children, obviously, because they don't have the same life experience and because they are children and they're at various levels of development, it can manifest itself in terms of withdrawal, a lack of speech, not talking, becoming kind of nonverbal, behavior, like really just out of the ordinary, just behavior. You can't sit down, you can't follow directions. And they're constantly receiving negative feedback. It can manifest itself in a disruption of sleep, rising too early, even a change in dietary habits. looking for something soothing, or comforting. So with children, it can manifest itself in so many ways. And I can tell you that we've had so many conversations, especially in pediatrics, over the past year about how this past year has had a significant impact on our children.
What would you say to parents that are listening?
I think that there are two things that need to happen. One is, if you have no idea where to start, your pediatrician is a good place to start. Just ask the question. I have a concern that maybe there's something going on. I don't know how to talk to them or what to do, or, she's so little, or he's 12 or he's 13 and he doesn't really talk to me very much. He just wants to go to his room, or what can I do? I think that's a really great place to start, just to express the concern so that you can start or initiate that conversation. I think asking them questions. Sometimes if you ask a question, I call it without a distraction with children, you may get the yes, no, at least when they're verbal enough to say the yes, no. So for those children who are over the age of 6, for example, they may or may not talk. So one of the ways we do that is at my house, and you can only believe, I'm sure you can't believe how hard this is, to just try to have a meal together because of work schedules and what we're accustomed, kids' schedules, and because we're so accustomed to kind of eating on the fly and consuming snacks and grabbing things. And I can't tell you how many times I've just pounded on the pavement. You cannot eat, between the hours of 4 and 6 unless it's dinner tonight. And even if you ate something, you absolutely have to, you must, hold on, Epic is taking over it's so obnoxious. Exit from hyperspace. You cannot go to your room during dinner time. You'll still have to sit at the table. And sometimes,
I like that.
Yeah.
And that.
I'm like, we're a family. Clearly, we can look at each other for 20 minutes out of 24 hours. And it doesn't happen every single day. During a good week, it may happen 2 or 3 times a week. No, a really good week is about 4 or 5 times a week. But sometimes there's a bad week and it's only once. And guess what? Sometimes we sit there, we look at each other, we eat, we may say 1 or 2 things to each other, and that's it. Other times there's story sharing, there's laughter. Guess what happened to me today? I don't like this. We talk about events. We can talk about why my son Joshua feels a certain way about a political campaign, or what happened at school, or it's an opportunity to just listen and hear how they think. Board games, or just playing games, or drawing, or painting, or doing anything where you can spend time together would be a great way with children to facilitate those observations and that conversation.
Oh, that's awesome, Dr. Singleton. I had one of my, I have a grief therapy practice that I work on 3 days a week. And I had a client ask me this week, can I just have good mental health without seeing you or without seeing a psychiatrist? And I said, well, I don't know the answer. You're here in my office, so I think that's a right step. It's a family that had a loss. They had a death. Yeah. And so we're working through the grieving process, and they're doing much better now than they were 90 days ago.
Right. Well, I don't think there's ever a replacement for a professional person, like yourself, someone who has training. I don't think that there's ever a replacement for that. And it doesn't necessarily mean that you have to see that person every single week for years on end. But I do think it is a healthy concept to have a therapist, a psychologist, maybe even a psychiatrist if you need medication support, to have someone who knows your name, who knows who you are, who knows something about you, and you feel relatively comfortable with that person. And if you can check in every 6 months at some point, once a month, every 2 weeks, if needed, once a week until, a crisis is over, twice a week, whatever it is, I think it's important to have that relationship. I also think, to answer her question, because it's partially yes, in between those times, I think that it's super important what goes into your brain.
Yes.
What are you listening to? What are you watching? When you're in the car, I'm super big into positive thoughts, and positive ways of problem solving and looking and viewing the world.
Mm-hmm.
So when I'm in my car, unfortunately, I feel like talk radio, and even NPR sometimes has been taken over, by just negative, constantly. So I think it's good to supplement, and you don't have to see anyone to listen to. I don't know. I listen to Power of a Praying Wife, for example. I listen to, is her name Brene Brown? I listen to, I forgot the name of the app. There's a Bible recap, or something like that. I'm like, for those of us who don't have time to, read the Bible the way we're supposed to.
We can listen to it, right, while we're in the car driving to work.
Yeah. So I think that she's onto something. So, sort of in between, times of seeking help, from a therapist, and I think that check-in is always great. Like, am I okay? Is this okay? Is everything okay? Am I taking care of myself? Okay. But there's a great way to do that. If you want to read those things, if you want to listen to those things, if you want to stop and take a weekend to regroup, a girls' retreat, boys' retreat, church retreat, or something to recharge. Quietly. Oh, I went to a silent retreat once. That was really hard, but it was very therapeutic. But it was very, very hard.
Well, when you have patients come in, Dr. Singleton, that even before they get there that they have a chronic illness, do you have any advice for the audience that are dealing with children or even themselves or a family member that have a chronic illness, how to handle this emotionally? I think that's tough on everybody, including the patient.
So there is a reason, when you are a pediatric hematologist oncologist, that a psychiatrist, psychologist, and social worker are permanent members of the team.
I think that's important for people to know.
You have to understand that. I often have to take some time to explain how we take care of the whole person. And no human being can have a chronic, and I want you to hear me when I say this. No human being can have a chronic illness, meaning something that you are dealing with, have to address every day, especially something that includes a regimen of medications, doctor's visits, procedures, a strain or change in your quality of life or routine. No one can do that without, or should do that without making sure that the most important system of your body, your central nervous system, is taken care of. No one should ever do that. But that's what most of us do every day. So when you walk into the world of pediatric oncology, I think that we do it right. And it may seem foreign to some people, but we have to explain, like, this is how we do it. We typically talk about, give some tips in terms of expectations and the way that children process stress, and especially focusing on different ages. You know, a 3-year-old will process things and handle things a little differently than an 8-year-old versus a 12-year-old or a 15-year-old, et cetera. But it is very important that you understand that if you have an illness that has gone on for some time, that not addressing your mental health, you're doing yourself and your body, your physical body, a complete disservice.
I like the support groups that a lot of facilities have, Dr. Singleton, that may meet once a month.
Yes.
And things may resume again in person now that the COVID vaccines are out there. I think those are so wonderful for patients, and encourage people to participate in it. They're all free. A lot of churches will even have grief support groups that meet once a month. And talking about things is how you make it better. Would you agree?
I agree. And I think that if you feel a little awkward going and you go and sit there and just listen, that's okay.
Yes.
If you go and you listen 5 times, that's okay. If you want to talk or share, that's okay. And sometimes you may need different things at different times. You know, sometimes you may process things differently. You're like, I don't know if I like this. Go 3 times.
Okay.
I think you should try 3 times before you totally, write the whole effort off. It is true. Sometimes you may not completely gel with a group. You may not completely gel with a therapist or a location. Don't give up. Find another group, find another location. But I think sometimes you should give it a try. Is my golden, and it's sort of an arbitrary number with me. I'll tell you, my 3 times comes from, we were a military family. And the thought was that someplace didn't really, really feel like home until 3 years later when it was time to go. So,
okay.
So 3 is a charm. I think you should give it a try 3 times. But those groups help many times so that you know that you're not by yourself.
Right.
Feeling isolated or feeling like you're the only one or something's wrong with you because this happened to you or you're thinking this way. It's a great relief to know that it's normal to feel certain ways, because again, going back to that word you used earlier, in your head sometimes you're saying, that I'm crazy. No, you're not. You're just normal and going through something. I do want to bring up something really quickly though.
Oh, go ahead. You got the floor.
Yeah, I want to say this really quickly. So, when you have, when you're stressed, and if you have anxiety or depression, or if you don't have anxiety or depression, when you feel isolated and lonely, that's a really tough spot to be in. The pandemic has only exacerbated those feelings that we have of loneliness or isolation. Someone who ordinarily may have called or stopped by, maybe you wouldn't have that feeling if you had just kind of daily interactions, even with people you didn't know, but you interacted with someone. So just be aware that you can have those feelings of isolation and loneliness, and that can make you feel depressed or can make depression feel worse. If you're feeling like that, just reach out to somebody.
Yes.
Just, pick up the phone, go find somebody. Now you can go sit out in the park with or without your mask, depending on the situation. But don't stay in that isolated state.
We draw energy from people, so I think that's a really important point to bring home. And there's, people that have been homebound for the last year. Michigan is still kind of in a tier 2 state, because I had calls with folks in Michigan yesterday, And so they're watching the rest of the world begin to open up, and Georgia's wide open. The mask mandate changed 2 weeks ago, so we're pretty much we're moving back to normal. It's a new normal, but reaching out to people. I think we air this show airs live on Facebook, so you'll see there may be 1,000 people watching in and out at one time, and then it's available later on. But people reach out to me. I've probably got 15 new messages this morning from people with varying issues. What can you do to help me? So I think that helping hand is to reach out, and just a smile. When you see people at the grocery store, you may be wearing a mask, but they can see your eyes are smiling. When you smile on your face, it shows in your eyes.
Yep. I mean, it's so helpful to do exactly what you just said. Just find a way, big or small, to engage.
I was going to ask you, does your office run any special programs for patients, Dr. Singleton? In Atlanta, we have a hemophilia camp that they host annually. We know they didn't last year during the pandemic, called Camp Wanna Clot.
Yeah.
So we've done some volunteer work with them. Is Louisiana Center for Advanced Medicine doing any types of work like that?
Absolutely. So we actually partner with our advocacy organizations, and we support them from a medical standpoint and an educational standpoint. So we have our own hemophilia clinic too. And so it's always a delightful place. I never turn down an invitation to go to camp.
Right.
Yeah, I look forward to it this year. This year, I'm actually going to go to the Alabama camp. And I'm very much so looking forward to spending time, with the kids, and just seeing them be free. And I also feel great because I feel like I help parents by knowing that I'm going to be there.
Yes.
With some of the kids, and I think they have a sort of sigh of relief that that's going to happen. But we absolutely partner with advocacy organizations here in Louisiana, Mississippi, Alabama, and Georgia. By the way, regionally, to make sure that we connect patients with opportunities to have a sense of support, to have fun activities, to participate in fun activities, to have fun learning opportunities. So it's so important to remain connected with your doctors, your hematologists, especially because many times we do have connections and programs and opportunities that will be really, really helpful. And there's one thing I used to say sort of to myself, and I don't know if anyone ever said it to me, like, where did I get it from? This was actually before I was married, and I said, well, I think I may want to get married one day. But I was busy, and I'm like, I don't want to go anywhere, and I don't want to dress up. And I kind of said, well, Tammy, you're not gonna meet somebody just sitting in your living room. You sort of have to go and do and adventure a little bit. So you have to go sometimes. You have to engage sometimes. And sometimes think of not saying no. Just go, unless I have to say no, because I just absolutely can't make it for this week. If I'm invited to something, or if I'm giving an opportunity, the answer will be yes. So just food for thought.
I've got people sending me text messages on my phone. Let me read you one of their questions. They want to know, we read an article about you on the World Hemophilia Federation's website. We did, and your patient said that you are the best hematologist ever. And as a nurse, and I've been a nurse for more than 40 years, so that's a day or two, I think the physician's bedside manner is probably the most important skill that you learn early on. What makes you the best hematologist? What would make your patient say that, Dr. Singleton?
Well, yeah. Well, so I think I'm probably a little nutty. Just a little bit. In that if something needs to be done, like I
Mm-hmm.
won't stop. And it may be a little pathological, but I don't have boundaries.
I love that.
I don't have boundaries, so I don't necessarily see something as someone else's job or responsibility. So if you're my patient and you need something, I'm gonna figure it out. Like I want to be surrounded by people too who are going to help me to figure it
To
out.
figure to
Yeah,
figure it out.
yeah. Like we need to. So this patient, and it may not, and it probably drives my staff nuts. Sometimes I'm sure it drives them nuts. Because they're like, why are we doing this? Like, why is this our responsibility? I'm like, because he needs it. Like we need to kind of make this happen. So I think that's part of it. I also think that I have to give credit to my parents. I kind of go back to that. My dad was this brilliant guy, like a walking encyclopedia. And I think that that's probably where some of the intellect comes from, that helps me to figure these things out. But my mother, I never met a person who didn't like her. Like she goes to the grocery store. Everybody knows Mrs. Chris and Terry at the grocery store. She walks into a room. Everybody knows who she is. Oh, I just love your mom. It just drives me crazy. But I think that it's because she's so genuine.
Yes.
She's unapologetically her. And I think that's part of it too. My intentions are always noble, with coming from a very genuine place and spirit. And I don't care who you are, how much money you have, from what region of the world you come, you deserve to be treated well. And I absolutely love and adore my patients. That's probably a little pathological too, because I probably like them way more than they like me. I really do. I haven't forgotten any of them. I can remember back all of them, like the 25 years.
Oh, wow.
And it is an honor and a blessing to do what I do. When you find your purpose, that's just such a
Yes.
a blessing. And I think that what we feel mutually is a person standing here before you where I would do this for free. Like I found my purpose. I'm happy and excited to be here. And even the grumpy ones, I'm like, how can I, even when you're grumpy, I'm like, look, how can I help you?
Yeah.
How can what can we do? And some people are just, every now and then some people are awful. And I'm like, listen, they're going through something.
Yes.
Let's do what we can, to try to
Yeah.
help this person.
I
So
think I think your positive attitude rubs off on your staff. There, when I have visited your clinic, everybody's smiling. No joke.
yeah,
Everybody, from the receptionist to the nurses to the
yeah.
pharmacist, and if
Yeah.
there happens to be another physician there, everybody has a smile on their face. I don't
Well,
see that every place I
well,
go.
but I will have to give some credit for that to Dr. Spencer Sullivan and the Mississippi Center for Advanced Medicine, who gave us an opportunity to have this location. And he sort of looked at me and said, who do you want to work with?
Oh,
And
wow, Dr. Singleton.
yeah, so rarely do you have an opportunity to go. I call them my over the cliff people. Like who's gonna go over a cliff with me? You, you,
Yeah.
and you. And what a blessing that we've had an opportunity to do that. And I think that even on days when we're tired,
Yeah.
and we've worked hard, I think here at the Louisiana Center for Advanced Medicine, and collectively with the Mississippi Center for Advanced Medicine, somebody called it Disney World one time. They did, and they're not wrong. They're not wrong, because we're here for the right reasons. And when we see
Yes.
something and it doesn't work, we just talk and fix it. There's no, red tape, and we don't have to beat our heads against the wall to try to do the right thing for the patients, the right thing for the center. I have to give, credit to Dr. Sullivan and that group for giving us an opportunity to have people that could come together we're just all like that. I have a great team there. I mean, it has been a blessing.
How far away do patients travel to see you, Dr. Singleton?
Oh,
since you're a specialist.
Yeah. So we've had patients travel from Georgia.
Okay.
We have patients who come from Alabama. They're primarily coming from Louisiana and Mississippi. But one of the cool things, and this was a eye-awakening kind of thing for me. One of the cool things is that I'm not in New Orleans anymore. I'm in Slidell, Louisiana, which is pretty close to the Mississippi border.
Yes.
And there's so many people that struggled to get into, a larger city so far away. There's so many people who hadn't seen a specialist in such a long time because they couldn't sort of overcome that barrier. And I think that we have, again, very noble intentions. We want to do the right thing. We're working hard in academic institutions. And my entire medical life, I've never been outside of a medical school until recently. So, I was at the University of Miami in training. I was at Hopkins in training. And then, I worked at LSU at Children's Hospital, again, academic medical center, Tulane School of Medicine, academic medical center. And you're there collectively and you have this mission and you want to serve the people and you want to do the right thing and you want to provide excellent, high level medical care to all comers because we're at the academic medical center. I never really thought about the struggle and perhaps there were patients that we were not serving because there were barriers that were in place that we really were not aware. We thought we had solutions for those. We thought we had transportation. We thought we had. So being here has been just an amazing experience to have an opportunity to serve.
So tell the audience how they could make an appointment with you, Dr. Singleton, if they have a hematology disorder and they would like to see you personally.
Absolutely. So you can Google the Mississippi Center for Advanced Medicine. We're linked on that website. Or, you can Google Singleton. Google does everything. You can Google me, Dr. Tammy Singleton. And the phone number here is 985-259-8045. 985-259-8045.
And I always encourage patients to get a second opinion. And if they're not happy with their physician, you need to look for another one.
Yeah, absolutely. So you have to have that great relationship. It's a relationship. Yes. It's important that you have that. But I always encourage, whenever we have a big diagnosis on deck, I go, listen, let me help you to get a second opinion. You're going to get one of two things. Either they're going to confirm that I was right and we didn't miss anything, or they'll say something else that's going to help both of us. It'll help me to take care of you if you want to stay here. If you like that person, you can go with my blessing. But I think that it's important that you ask the same question multiple times. And that's also something I do kind of behind the scenes, me and my no boundaries and craziness. I'm always talking to other doctors, like trying to figure things out to make sure that I'm not missing anything.
I think that's awesome. Dr. Singleton, any closing comments for the audience? We've got about 60 seconds left.
Yeah. Guys, your state of mind and mental health is everything. Let's drop being ashamed like dirty clothes. Let's just drop it. Just let it go. And all you have to do is pick up the phone and find somebody. It's totally confidential. It's your private business. But stay healthy, live your best life. And the only way you can do that is to make sure that you take care of your mental health too. So,
Dr. Singleton, thank you so much for taking time out of your busy schedule to join us today.
I'm honored to have been asked.
Oh, if you got something else you want to talk about, you send me an email or call me up and we'll have you and Dr. Sullivan both.
Be careful. Be careful what you ask for.
And for our audience, thank you so much for joining us today. This is Gail Trauco with Healthcare 911. You can reach me, Gail, at Medical Bill 911. We're glad it's Friday and it's going to be 5 o'clock here on East Coast in about 3 hours. We'll see y'all next week on Healthcare 911. Bye, Dr. Singleton.
Bye. Thanks for having me.